Hello, everyone. Welcome to this session of MRCP Part 1 lecture series with Cardiology. My name is Dr. Pradeep Shenoy, one of the mentors for this program. So, MRCP Part 1 exam, as you know, is an best of 5 format exam where you need to give answer 100 questions in the morning session and 100 questions in the second session. Totally, you will have 200 questions. And as per the Royal College, the specialty-wise division of these questions are as shown in the slides. So today, as we're going to discuss about cardiology, so cardiology, you will face 14 questions out of the 200 questions which you will face in the exam. And in today's topic on cardiology, so these are the topics which we are going to cover in this recorded lecture. It starts from coronary anatomy, pulse characteristics, JVP, ECG, pericardial diseases such as pericarditis, cardiac tamponade, infective endocarditis, heart failure, coronary artery disease, including approach to chest pain and cardiac arrhythmias. So let us begin the lecture with the brief anatomy of the heart. As you know, human heart has 4 chambers, as you can see in this image. So we have 2 atria, right atrium and the left atrium, which are separated by the interatrial septum. Then we have the 2 ventricles, the right ventricle and the left ventricle, separated by the interventricular septum. Here, what is very clear is that the left ventricle is much larger or bigger than the right ventricle. And also, if you look at the muscle mass, left ventricle is much thicker compared to the right ventricle. The right ventricle has to pump the blood into the pulmonary arteries, which will enter into pulmonary circulation, which is a low pressure system, whereas the left ventricle has to pump the blood into the ascending aorta, which is a systemic circulation, which is at a much higher pressure. In addition, you can also see the 2 vena cavae. You can have superior vena cava, inferior vena cava, both opening into the right atrium. You can see tricuspid wall, which basically there in between the right atrium and the right ventricle. It is called tricuspid wall because there are 3 cusps in that wall. You can see what are known as papillary muscles. There are papillary muscles both in the ventricle and both right and the left ventricle. And with the help of the papillary muscles, the walls are attached with the help of what is called as chordae tendineae. So we have papillary muscles with their attached chordae tendineae, which will fuse with the respective wall, either tricuspid or mitral wall. On the other hand, we have the left atrium and we have the mitral wall. In contrast to tricuspid wall, mitral wall has 2 cusps, anterior and the posterior cusp. And you can also see the papillary muscles here with their chordae tendineae. You can also see opening of the pulmonary veins. You can see 2 openings in the left atrium. There are 4 veins which drain the blood from the lungs back into the left atrium. And the blood is pumped from the left atrium into the left ventricle. So let us quickly revise the cardiac cycle here. The blood will enter into the right atrium with the help of the superior and the inferior vena cava. Then there will be a right atrial contraction, which will pump the blood into the right ventricle via the tricuspid wall. The blood will accumulate in the tricuspid wall, and at a certain pressure, the right ventricle will contract, and that will push the blood into the pulmonary artery via the pulmonary wall. The blood will flow from the pulmonary artery into capillaries and pulmonary circulation, get oxygenated via the blood, and the oxygenated blood will return into the left atrium via the pulmonary veins. The blood from the left atrium will enter into the left ventricle via the mitral wall, and the blood from the left ventricle is pumped into the ascending aorta via the aortic wall. From the ascending aorta, the blood is distributed both to the upper segment, head and neck area, as well as the upper limb, lower limbs, and other part of the body with the force which is originated from the left ventricle. You can also see here we have the ascending aorta and arch of aorta. So there are 3 main important great vessels which are originating from the arch of aorta, including brachiocephalic trunk. We have the left subclavian artery and we have left common carotid artery. You can also see the continuation of the arch of aorta as a descending aorta. You can see somewhere here in the figure, the descending aorta, which basically enters from thorax, then into the abdomen, and giving multiple branches, both anterior and lateral branches in the abdomen. So this is the brief anatomy of the heart and the brief cardiac cycle for you.